Welcome to the Primary Care Clerkship ECG Workshop Podcast. My name is Dr. Melissa Stiles from the Department of Family Medicine, and I would like to introduce Dr. Dean Keller, a general internist from UW West Clinic, who has been leading the ECG workshops for students for many years. Thanks for joining us, Dean. So before we get started, is there anything the students should be aware of, Dean?
Yes, Melissa. There's two things, and I believe they're on the first slide with the Bucky Badger on it. One is to introduce our website, and you can see the address on there. And this website is a great reference for the podcast. There are some self-assessment quizzes and clinical cases on it. And the second issue is they should print off a copy of the guidelines, and the directions are on the slide, and have this in their hands as they watch the podcast, and this will be very helpful.
I've had a chance to look at the guidelines. They look very complete. Is this essentially what they need to know?
Yeah, the guidelines really is the entire course on a single page.
Well, let's talk about this podcast today. What are you going to emphasize?
Two things. One is, after having taught this for many years, we've got some very good student questions that come up, and I'll try to talk about some of those. And secondly is we'd like to tie in the clinical importance of ECG interpretations for the students as they provide care for patients in the primary care clerkship setting, on their ward rotations, and many of the students actually come back to this their fourth year as well.
Well, let's launch into the first category, rate. Any thoughts on this topic? And by the way, do they need to follow the card in sequence?
I think following the card in sequence will assure a complete reading, and this is a good way to start. Later they can perhaps develop their own methods, but sometimes it's easy to jump to an obvious problem and then not have a complete reading and see some of the other things. So that's why we recommend starting out this way at least. And for rate, we have 3 examples. The first example, also called the common method, is one that probably will be used for 90 or 95% of the ECG readings. And I would definitely recommend memorizing the number sequence 300, 150, 100, 75, 60, and 50. This is particularly useful if you have to read a stack of 50 ECGs when you're on some of your rotation. The other 2 methods are used much less frequently and under certain circumstances. Perhaps looking at the examples would help. The common method slide shows 3 different tracings, and by starting out finding an R wave on a heavy red line, you simply count over the number of large boxes to get the rate. So 300, 150, 175, and then 60, so that would be your rate on the first example. The second tachycardia example would be 300, 150, and the next one would be 300, 150, and 100. And again, just memorizing these numbers will make it so much quicker. The second method generally will be used when you have a regular rhythm, but the bradycardia is such that you'll run out of numbers if you try using the common method. The example here, you can find an R wave on a red line. The first complex might be a good one, and then count over the number of large boxes. In this case it happens to be 7.5. A little bit of an unusual number, but you divide 300 by that number and it'll give you a rate of about 40. If there's 10 boxes between them, for instance, 300 divided by 10 would give you a rate of 30, and this is where the numbers from the common method are calculated from. And finally, the third example is when you have an irregularly irregular rhythm and you need to take an average. This is an example of atrial fibrillation, which is probably one of the most common sustained outpatient arrhythmias that we see. So you will occasionally be using this. I took the liberty of labeling the 30 boxes on the slide, And remembering that a large box is 0.02 seconds, 30 multiplied by 0.02 will give you 6 seconds. That's why we pick that. It's a nice range to give you an average. And if you notice on the slide, what we're interested in is the number of R to R intervals, which is one R wave to the next R wave, not the number of R waves. So be sure you count the intervals, then you multiply that by 10 to get your 60-second reading. In this case, 8 intervals multiplied by 10 would give you a rate of 80.
Oh, great. So we have a variety of methods, but you really emphasize the first one is probably the most useful and one we've been using the most, I guess.
It's one of those things like in anatomy. You just memorize it, and hopefully we'll use it for a good part of the rest of your career.
I understand rhythm will be done separately, so let's move on to axis. So what is important about QRS axis, and why don't you label it in degrees?
I think for the purposes of our course, we really only care if the axis is normal, to the right, or to the left. Calculating in degrees takes extra steps. You have to find an isoelectric lead, find a perpendicular line to it, and I don't think it's really helpful at this point. If the axis is 40 degrees or 60 degrees, it's still in the normal quadrant, and that's mainly what I'm looking for. And the reason we do this is because there's a differential diagnosis for left axis and right axis deviation. It's listed in the guideline. And basically there's some kind of an infarct, some kind of hypertrophy, or there would be a fascicular block. This is a diagnosis of exclusion, so think of fascicular block only if you don't see infarct or hypertrophy.
So if there is a left or right axis deviation, this is really a tip-off that one of the above abnormalities exists.
Absolutely. That's why the QRS axis is very clinically useful. And the differential diagnosis is probably also well worth memorizing as you go through the next couple of years of the students' clerkships.